Major move from the Trump administration that could affect millions of people on Medicaid. ABC Action News anchor Paul LeGrone is here with the reason people may soon have to work for their benefits, Paul.
Yeah, a lot of confusion over this one, Jameson. Tonight, the White House says it will start allowing states for the first time to impose work requirements on Medicaid recipients. But as we learned today, there are some exceptions. Tonight, the Trump administration issuing this memo to Medicaid directors all over the country, encouraging states to start requiring able-bodied Medicaid recipients to work or volunteer in order to keep their health insurance coverage. It's a move that impacts millions.
That if you're receiving public benefits and you're not working, you're less likely to seek jobs. And if you're not employed in the marketplace, you're not going to be able to get access to private health insurance benefits.
One group potentially impacted the most by the change, people addicted to opioids. Medicaid is often used to pay for a wide range of treatments and medications, while the addicts themselves are unable to work or find anyone willing to hire them.
In many respects, this is a political statement, but it's also an important public policy statement for those people who believe that if you're receiving public benefits, you should be contributing something back in the way of working or trying to improve yourself.
There are some exceptions to the work requirement. The Trump administration says pregnant women, the elderly, children, or people who can prove that they're unable to work because of a disability. Caregivers may also be exempt. But precisely who qualifies and who doesn't is still very unsettled.
Florida is not one of the 20-some states that expanded Medicaid to allow people who make more money to participate, so we will be less affected than some of those other states.
Tonight, officials with St. Joseph's Hospital telling ABC Action News that because Governor Rick Scott did not opt to expand Medicaid coverage, there could be fewer people impacted here in Florida. So what about us? Well, tonight we're getting late word. I just got this sent to me from the governor's office saying, quote, this would require legislative action from the Florida legislature, which is currently in session. And it says Governor Scott will review any bill that reaches his desk. Also tonight, while critics claim that the president will essentially force sick people to work, the White House is arguing that there is sufficient evidence that shows that work and community engagement improves the health of people on Medicaid.